Hey, Board Chair Chop, everyone on the board is in attendance and we are live.
Okay, sounds good. Thanks, Kevin. Good afternoon, everyone. We're going to start today with our Board of Health meeting, and then we will begin with the public hearings meeting at 3 p.m. today. So with that, I will call to order the Board of Health and welcome all members to the meeting. If I could have a motion to approve the agenda as amended, which includes Dr. Strauss's report that was published this morning. Councillor Taylor, thank you. Seconded by Member Columbus. All those in favor? And that's carried. Any declarations of pecuniary interest? Okay, seeing none then, Dr. Strauss, welcome. I will turn it over to yourself for your update.
Thank you, Board Chair Chop. It's always a pleasure to address the board through you. I've done a bit of a more comprehensive report today. It's now been 6 months that I've been, or just about 6 months that I've been in Haldeman, Norfolk as the acting medical officer. So I've done something of a bit of more retrospective analysis. And I think the time was right for this because I think we're really at a pivot position with respect to our public health response and the pandemic. So it's a very exciting and hopeful time. In Ontario, ICU occupancy from COVID-19 is down, hospitalizations are down, case rates are down, wastewater signal is down. I just received a report this morning that there is exactly one person from Haldeman, Norfolk currently in ICU with COVID-19. So that's about the lowest that it's been for months. I certainly wish that person well. Many jurisdictions, many countries have done away almost entirely with public health restrictions. So Sweden, Norway, Denmark, Ireland, the UK, Portugal, Mexico, Saskatchewan, Alberta, and Ontario reduced quite a raft of restrictions today, including proof of vaccination requirement. I expect, and I think broadly, the public health establishment in this province expects that these trends will continue throughout March and into the spring. When we spoke in January, I had mentioned that perhaps in March we would speak of the pandemic that was rather than the pandemic that is, and I do believe we're more or less ready to make that shift over this month in March. So to be clear, COVID-19 will always be with us. Adherence to vaccination recommendations will remain an integral part of personal health protection. However, I do not believe that we are likely to see unexpected and massive waves of COVID-19 in an immunologically naive population again. The Omicron wave infected millions and millions of Ontarians. Some estimates are as much as 6 million people might have been infected in Ontario in the last 3 months. So that's not good, and we saw the outcomes of that in terms of hospitalizations over the last little while. But the silver lining there is that's millions and millions of Ontarians who we believe will have robust natural immunity going forward, in addition to our vaccination program, which has also been very robust. In my meetings with other MOHs and with the Chief Medical Officer of Health and the Ministry, it's clear that there will be ongoing monitoring for any new worrisome variants. And that monitoring will be similar to the monitoring that goes on every year regarding influenza, or has been for the last 20 years. So it's not a time to go to sleep. It's not that we're forgetting about COVID, but it is not the sort of public health emergency today that it has been over the last 2 years. So in this kind of pivot position, I wanted to go through some of the outcome metrics here in Haldeman, Norfolk. I acknowledge it's been emotionally and materially a very difficult time for everyone in this community, everyone in this province, everyone in the world. COVID has been a dreadful disease, and our community has suffered significant losses. At times there have been disagreements, locally, provincially, nationally, about the best way to temper those losses. I believe it's Kierkegaard said life can only be understood backwards, but it must be lived forwards, and I think we can do some understanding backwards now. Making decisions in real time with incomplete data can be difficult and confusion can ensue. We now have 2 years of data, and I think we have a great opportunity for agreement and cohesive action. And as we look through it, I think you'll find we have a lot to be proud of as a community here, and now is a great time to put divisions aside and heal. So let's go through some of that data. I'm going to try to share my screen, which is a bit of a new trick for me. Here we go. So here's just the figures and tables from my report. Can everyone see that all right? Oh, I should, I'm not a Windows person generally. Where is play slideshow? Oh, there it is. So this figure does not have Haldeman Norfolk on it. This figure, I can only graph 5 health units at a time from the provincial website. Here I took the 3 largest cities in Ontario and then 2 sort of well-known rural or remote places. And I think this graph tells the story of how, in general, internationally, the urban and rural experience has been different. So the larger the city, the faster it was hit and the harder it was hit. So Toronto's this purple line you can see out of the gate. They unfortunately had the most deaths from COVID-19. Ottawa was a close second. Hamilton was spared until about a year ago when they really took off. You can see that, so the blue line is Muskoka and the yellow line is Thunder Bay. They were spared really just about the first year of pandemic-related mortality, but eventually, time being a great equalizer, they started to catch up with Ottawa. So that's something to bear in mind when we look at our local statistic, is that urban-rural difference. So here is Haldeman Norfolk, the purple line, along with 4 rural health regions in southwestern Ontario. So we had a peculiar experience that is different from the story I just told you, in that in Haldeman Norfolk, out of the gate, mortality looked a lot more like Toronto. And I wasn't there at the time. From my understanding of what happened, I think it was literally unfortunate in that it was what statisticians would call stochastics, but most of us would call bad luck. There were some peculiar outbreak experiences that really drove this initial mortality experience. Over time, again, time has been a great equalizer. We can see, so 6 months ago, which is the period I'm more familiar with, we were roughly equal with Lambton, and the other 3 comparators were well below us. Today is the end of the graph. Lambton's really pulled ahead, and we're roughly equal with the other 4 comparator regions. I believe that if you it's in my report, if you take the average of increase of COVID-19 deaths over the last 6 months for these 5, I believe it's something like mortality has increased in the average health unit among these 5 by 95%, but in Haldeman Norfolk only 55%. Oh, and then here's the 3rd figure. So these are Haldeman Norfolk and our 4 neighbors. Again, you can see we still have this peculiar early experience where the purple line again. Then we see the urban-rural divide happening with Niagara and Hamilton really taking off. 6 months ago, we were ahead, unfortunately, in terms of mortality of our neighbor to the west and our neighbor to the north. And we still are, but that difference has markedly diminished. So I believe if you average the mortality increase over the last 6 months for these 5, it's something like 75%, and in Haldeman Norfolk only 55%. I believe if you do that, and I will look it up from my notes. If you do that for the whole province, you get 115% COVID-19 mortality increase over the last 6 months for the average health unit, and ours again is only 55%. This last slide was actually prepared for me by an actuary. So if you look at the raw mortality data for Haldeman Norfolk over the whole 2 years, we are 10% lower per capita than the province. But as you're all well aware, Haldeman Norfolk is a popular retirement destination, and so elderly folks are much higher risk to suffer death from COVID-19. So this is an age standardized table that shows if you correct for age for the relatively older segment of our population, we had a 72% mortality compared to the rest of the province, so a 28% decrease. Go back to my teams and how do I stop sharing? There it is. Okay. So I think that as we close this chapter in our local history, we can be proud of our performance. I'm proud of all the public health unit staff. I'm proud of all the county staff. I'm proud of all the healthcare workers in town, and frankly, of every community member who worked and sacrificed to look after each other over this difficult period. Part of what is so remarkable here is that in many ways, rural communities have the deck stacked against them. So Halton Norfolk is not an outlier in that way, but there are 5 times fewer physicians here per capita than the provincial average. So we've done more with less. There are social determinants of health that are unfavorable here. So cigarette smoking is more common, car accidents are more common, teen pregnancy, obesity, mental health concerns, vaccine hesitancy. And as we previously discussed at a Board of Health meeting, the rates of venereal diseases are markedly on the rise. So these statistics are not good, but as far as the pandemic's concerned, this community has outperformed. So statistics aren't the whole story. I think that there's strengths in this community that the statistics obviously don't capture. So this is not a time to rest on our laurels. For each of these kind of worrisome statistics that I mentioned, there's a lot of work to do. And as the pandemic is nearing its end, I'm going to be turning my focus to these other critical files. So I'm happy to report to you that the public health unit will be opening its doors to the public in the next couple of weeks. We are cleaning children's teeth again. We're going to be sending nurses to help young mothers breastfeed again. And we're going to be designing new programs to improve the whole of the public health and not just the COVID-19 public health. So I'm very grateful for the opportunity to be here over this time. I'm grateful for the faith the board's expressed in me, and I'm grateful for all of the work all of the community has done. And I think that's I think this is the end of a chapter. So thanks very much for your time, and I'm always happy to take your questions.
Thanks very much for your report, Dr. Strauss. It's great to hear that we're going to be opening the doors again to the public health unit for sure. Councillor Martin first, or Member Martin, I should say, and then Member Vanden Rieschie, followed by Member Columbus.
Thank you, Board Chair Chop. Thanks, Dr. Strauss, for the written report. I think it's really great to kind of document where we're at and put it in writing for the sake of history at the very least, but it's also really great to see those local comparators. So thank you for putting that together as a visual. My first question for you is, obviously this was worldwide, Canada-wide, also provincially wide, but when we look at our death figures, we know that we can attribute a lot of that to outbreaks in long-term care. Specifically here in Haldimand and Norfolk, has there been any discussion about learning lessons from our long-term care facilities? I know that there will be provincially regulated documents that will change how long-term care operates in the future, but has there been discussions on our local level about things that we've learned, things that we will be implementing to do better through the long-term care operations setting, should we find ourselves in an additional outbreak?
The short answer is yes. There have been all sorts of discussions. Those discussions are ongoing. Those discussions have been transformed time and again as the pandemic has gone on. I think my initial reflections are, well, I mean, you can do a PhD in this topic. There are so many ways in which health, and not just infection control in nursing homes, have been overlooked in our province for 25 years. I guess I have too much to say on this topic to really. It would be quite another PowerPoint presentation. The important thing, I think, locally that I have found in my 6 months of work here is that relationships matter a whole lot, and I think that's a big part. When I talked about resiliencies in our community that aren't captured in the statistics, those good relationships between our public health nurses and our nursing homes and our hospital, I can't put that on a spreadsheet, but it exists and it's been super helpful, and I hope that's something we continue to capitalize on going forward.
Okay, thank you. My second question to you is about the role of the public health unit concerning vaccinations going forward. We know today that, restrictions are loosening and gathering places no longer need to check for proof of vaccination. What is the role that we will play, and how much time and resources are going to be allocated from the health unit here in our region? How does that change?
Yeah, it is not entirely within my power to dictate what that role will be. There are ongoing conversations with the ministry, and the Council of Medical Officers of Health has a vaccination working group, and these bodies are constantly speaking with each other. I think that one community partner that really stepped up to the plate has been pharmacies. They have done an amazing amount of work, and that is not something, they were involved with flu vaccines in the past, but that rollout has been really incredible. So I know the ministry has been very pleased with what the public health units have been able to do, but also very pleased with what pharmacies have been able to do. In terms of locally, we're very excited to catch up on all the school vaccines that have been given a little bit of short shrift over the COVID vaccination era. So there's definitely a lot of work to do there in terms of school clinics for measles, mumps, and rubella, that sort of thing. The ministry is very supportive of us getting that backlog done. The ministry has indicated it expects the public health unit to continue to take a role in COVID-19 vaccination going forward. I suspect we will be looking at something like yearly boosters in long-term care homes to tie into your previous question. And the ministry has indicated that whatever it ends up asking us to do, it will certainly financially support. So again, until final decisions are made, and they're not necessarily entirely mine to make, I can't speak concretely, but that's about the landscape right now.
Okay, thank you. My last question is a bit of a two-part question, but you mentioned at our last meeting and again today in your presentation about resuming other programs and that the health unit is offering. So my first question, I guess, is, besides what you've listed here today, breastfeeding and school programming, what are the priorities and what can we start to see coming back online? And further to that, has there been any discussions or consideration given to mental health programming? Because I think that's such a large part of COVID. And most recently, I have noticed that the Ottawa Public Health Unit has been doing a lot of messaging concerning mental health, mostly coming out of the convoy and a few other incidents that followed that were unrelated. But they've been really pushing that messaging about how to ensure that you're prioritizing mental health and what that means and what resources are available. So other programming coming back online, the priorities of it, and have we been having discussions about how we can assist our community with mental health concerns moving forward?
Right. So for I guess the first part of your question, I wouldn't want to enumerate all of the programs, that will be resuming for fear of leaving one out. But the school health program, being in schools, talking to kids about nutrition, and then one new program that I'm very excited about, and which is still only in I guess I would say a planning phase, is a particular focus on women's health that has been brought into focus, I think, by the closure of the labor and delivery service at Norfolk General, and then there was some unfortunate statistics that have arisen about vaccination rates in pregnant women and how these factors might be related. So we are looking at striking Women's Health Collective at the Public Health Unit, which I will not be leading, myself being male, but that is one of the sort of new programs that I think I'm very excited about and very supportive of, and will be, doing my best to help implement and support in every way that I can. It is widely acknowledged at the health unit that mental health, moving to the second part of your question, is going to be it already was a humongous challenge, has been exacerbated by the pandemic. And I think that there's a lot of, without being critical of anything that any other public health unit has employed, I myself am very interested in program design, and perhaps it's a bias of mine, less interested in messaging, let's say. So I think there's a lot of work that has to be done in terms of conceptualization about what are the resources that we have, what can we do, and what's going to be effective, and then how are we going to roll that out. But certainly I can say it is top of mind for the whole management team and indeed the whole public health unit.
Okay, thank you. That's great. I appreciate it.
Councillor Member Van Den Rishi, go ahead, please.
Yeah, thank you, Madam Chair. And through you, thank you, Dr. Strauss, for your report. It's always sad to hear that there was significant loss of life, and my heart goes out to those families who, unfortunately, the family have lost members. Through the pandemic, and we're at the tail end. Let's hope and pray that you are correct and that everyone else is correct, and that we are at the tail end. What have we learned, do you think? What would be something you would make front and center? What suggestion would you make that we can improve? What shortfalls did we have, or what improvement could we do, knowing that if we ever had something happen like this again, what would be the number one thought that you would have to make things better and to start off out of the gate in a better situation than we did?
That's another fantastic question that I could spend a month preparing a report on, and there will be reports, there will be royal commissions, there will be public inquiries. I guess some things that are near and dear to my heart. One, I'm a hospital physician, or was for the last 10 years. Our hospital system has been woefully underfunded, underprepared for something like this. So if you Google Ontario hospitals overwhelmed 2017, you will find articles in the Globe and Mail. If you Google Ontario hospitals overwhelmed 2007, you will find articles in the Globe and Mail, and those articles don't really give it the situation justice. Like I have personally told a 70-year-old woman that she might as well take her 92-year-old mother with pneumonia home because she's been waiting in the hall for 3 days, and that was before the pandemic. So, and then. And I can't do justice to the military's report on the conditions in nursing homes in this province, but it's dreadful. It's horrible. So we really have to get serious about what our healthcare system looks like and who has been hurt by the lack of ability for our hospital to deal with folks who are in a bad way. That's my bias coming from the hospital, you can imagine. Beyond that, I think that there was politicization and sensationalization during this pandemic. COVID-19 is a very serious illness. It has bereaved many families, as we've both acknowledged. But there's a whole rest of public health. There's a whole. I do think we will find that we've been a bit myopic. So. In the first 6 months of this pandemic in Ontario, opioid overdose deaths quadrupled, and I think part of that was because we shot ourselves in the foot in some ways in terms of our focus on COVID-19. So those are a couple of learning points that I might mention, but there will be books written on this topic. I'm certain.
I can appreciate what you're saying, but at the end of the day, here in Haldeman, Norfolk, would there be something you could, if there was something you could change of how the outcome was with COVID-19, if there's something we could have done, or we will have, that we have learned that if something ever happened again, this would be a priority to you as something we could change to make better, to improve?
So I was only here for the last 25% of the pandemic, I guess I would say, and I certainly don't want to criticize anything that happened beforehand. I think that, and I've spoken about this issue before. I don't know if at this table, but certainly in interviews. The vaccines save lives like gangbusters. We do have more vaccine hesitancy in this community than in other places, and it's not enough to merely stamp our foot and say that that's a problem. There are more or less sophisticated ways of addressing that problem. And I think trust and relationships are the more successful ways. I've often quoted actually current and former philosophy professor Maya Goldenberg. She's a philosopher. She's a professor at the University of Guelph, where I studied. She wrote a book that came out just this past summer on vaccine hesitancy, where she really formulates it as a problem of trust in institutions. So I think that having that at top of mind, how do we build trust in our, speaking for my role in the public health unit, and how do we, and it is my belief that you build trust through relationships and about caring for people. And I think we've had some success adopting that posture. And I think, but I think we can, if we continue to build that trust for the next 10 years, the next time something like this happens, we'll be in a much better position.
Yes, I agree with you. Thank you very much. improving and building trust would be something priority for hope never a next time. Thank you.
Member Columbus, go ahead.
Yes, thank you, Chair Chop. Dr. Strauss, you've been here for 6 months, as you mentioned, and I really appreciated the fact that you've made some good messaging and some predictions before other areas actually even thought of it, I guess. And you were pretty close to being right on, and you're forward thinking and handling the COVID in your first 6 months here. My question is with respect to the migrant farm worker program, which you did not discuss. As you know, March 1st is the time when all the farmers are starting to think what crops they're going to grow, what acreages they're going to plant, how much manpower or person power they're going to need. Can you comment for us as to where your communication is with that? And are there any hiccups coming forward, or is everything going to be smooth sailing as it is throughout other municipalities, other health units in the province?
Thank you for the question. As you know, I'm always very reluctant to make predictions. I think that there will be COVID-19 among migrant workers. Thankfully, migrant worker populations are very highly vaccinated. And also, the Omicron wave has blown through Ontario. It has also blown through every country on Earth, including those countries from which the migrant farm workers arrive. So I think that they will have both vaccine immunity and robust natural immunity in wide measure. So sure, there will be outbreaks, sure there will be cases. I very much hope, even go so far as to anticipate that there will not be deaths. That's about my outlook.
Thank you.
Member Huffman, go ahead.
Thank you, Board Chair Chop. Thank you, Dr. Strauss, for your report. It was very helpful, the visuals and the written aspect of it. I guess my question is that it's really boggled my mind in terms of the vaccine hesitancy numbers that we have here in Haldimand, Norfolk. And I guess in terms of looking at things going forward, do you feel that the vaccine hesitancy issue correlates to the uptake of future public health initiatives? Are we behind the 8 ball in some of these things? Do we have a community that is hesitant to uptake some new measures and some new way of doing things?
I have to think about that. I guess to me, so the vaccination numbers are one of these things that easily go into a spreadsheet. And so it gets a lot of attention because it's there in black and white. And I guess, and I'm not saying those numbers don't matter. What I'm saying is there is something else going on such that our mortality was lower than provincially. So I think that the community has resiliencies that more than outweigh a challenge like that. And that resiliency, I think, goes back to trust and relationships. So that we're a small health unit, and I've been able to have one-on-one conversations with just about everyone who calls my office. And a focus of mine in terms of my public commentary and my own thinking about this topic has been focused protection and prioritizing those most at risk. And I keep coming back to those conversations I've had where I spoke with somebody in their mid 40s or early 50s, who at the end of the conversation said, "Well, I'm never getting my child vaccinated, but fine, I'll get vaccinated since you've convinced me." So if we can get the right people vaccinated, if we can build those relationships and just get those who are really highly at risk vaccinated, then healthy 7-year-olds become less of a priority. So I think that's how we're going to proceed in the future. So again, the numbers might not look perfect, but those relationships and those resiliencies are there, and then we can end up having better health outcomes than some of our comparators through that part.
Okay.
Sorry, that was a
Okay.
really long-winded answer, but
That's okay. Thank you very much.
that was the toughest question. So
Thanks very much, Dr. Strauss. Any further questions from the board? Okay, if not, then if I could have a motion to receive Dr. Strauss's update as information. Member Taylor, thank you. Second by Member Huffman. All those in favor? And that is carried. Thanks, Dr. Strauss, for joining us.
thank you all.
Moving on now to the approval of minutes. We have the minutes of February 1st, both the open and closed minutes of February 14th special meeting before us. Are there any errors or omissions? Okay, seeing none, if I could have then a motion to adopt, please. Member Vanden Rishi, second by Member Michelli. All those in favor? That is carried. No communications today. No staff reports either. Are there any general announcements related to the Board of Health? Okay, seeing none then, we'll just move on to the confirming bylaw, which is Bylaw 2022-05BH, being a bylaw to confirm the proceedings of the regular Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held on the 1st of March 2022 to be approved, signed by the chair and board clerk and affixed with a corporate seal. Mover and a seconder, please. Member Taylor, seconded by Member Rabbits. All those in favor? That is carried. And finally, a motion to adjourn. Member Huffman, thanks. And seconded by Member Taylor. All those in favor? That is carried. So thanks very much, everyone. It's 2:30 here, and we will see you back at 3 p.m.